Hello, my name is Gitanjali Massey and I'm going to be doing a physical examination you. Do you consent me to do that?
Yes.
Okay. So do you want to tell me a little bit about yourself?
Yes. My name is Richie Massey. I'm 23, female. I'm on no medications. I have no history of surgeries or any injuries.
All right. So I did wash my hands, and do you mind if you take your eyeglasses, because I'm going to start with the eyes. So first I'm going to inspect your eyes, and I'm going to ask you a few questions. Do you have any drainage?
No.
Redness, vision problem, eye pain?
No.
When was your eye exam last time?
6 months ago.
Okay, and then if you have any vision problems in future, do you think you will be able to cope up with that?
Maybe, but I don't know yet.
Oh, okay. So first I'm going to inspect your conjunctiva and sclera. Okay, and then I'm going to do the Snellen eye chart. I'm going to assume I don't have a perfect one, so I have a small, I'm going to do the farsightedness and the nearsightedness. So I want you to read that for me.
EGHZXY.
Oh, okay, good. And then I want you to read this. This is for your nearsightedness.
Bob lived in a greenhouse with his 2 dogs.
Okay, good. Now I'm going to do your confrontations test. You're going to watch me, and I'm going to ask you when you see the numbers.
2, 3, 2, 2.
Oh, okay. And I'm going to do the 6 cardinal signs with you. So then for that, whenever, if you close one of your eye, and then you just tell me when you see the object. So.
No. No. No.
Yeah, then.
No. No. No.
Okay. So I'm going to check your pupils. I don't have a pen light, but I have this flashlight. So I'm going to be checking your pupils. They should be round, reactive to light. So I'm going to be checking that. Okay, they look good. They look round and reactive to the light. So according to me, your vision looks fine, and you have corrected glasses, and basically your eyes look fine to me. Now we are going to do your nose, your sinuses, and your throat. Any discharge from your nose? Any nasal swelling?
No.
Any bleeding? Any colds?
No.
Any allergies?
No.
Okay, so first I'm gonna inspect your nose. Your nasal septum looks fine to me. It's in midline. And then I'm gonna check your nasal passages. Any breathing problems?
No.
No problems with exchanging the air. So I'm gonna check with my flashlight your nasal cavity. It looks fine. No blockage or anything. And the nasal septum looks fine. Can you cover your nose and you breathe through one nose? And the other one? Do you use anything for your nasal spray or Flonase over the counter?
No.
Okay. Now I'm going to check your sinuses. So I'm going to check your frontal. Any pain when I palpate the sinuses? Okay. No allergies, you told me. And now I'm going to do the translumination test. I'm going to turn the light off. I'm gonna put the flashlight, and then if you can open I can see the translumination. It looks fine. I don't see any swelling or anything. It's illuminated with the flashlight. So sinuses look fine, and I'm gonna turn the light on, and I'm gonna check your mouth now. If you can open the mouth, first I'm gonna inspect your tongue, your dorsal and ventral tongue. Can you lift your tongue on the top of that? Looks fine. Your veins look, I can see the ventral tongue, the veins, the dorsal looks fine with the grooves. The teeth look fine. I don't see any bleeding or anything. I'm going to palpate your tongue. The vulva looks fine. Yeah. Okay. And I wash my hands. And I'm going to ask you, do you visit the dental? Do you go for your dental cleaning?
Yes.
How many times a year?
Twice every 6
And
months.
how about your dental hygiene? Are you like doing your dental hygiene?
Yes, I brush and floss twice a day.
No bleeding gums or any pain, so you regularly take care of your dental. Okay, so inspect your ears. I'm going to do your ear test. So first, do you have any ear pain, any drainage, anything,
No,
any hearing loss,
no,
anything like the environmental issues with your environment that like deficits your hearing?
no,
Okay. So first I'm gonna inspect your ear for any drainage or anything. They look fine. You're checking your ear canal with a flashlight, and I'm gonna be doing a whisper test. First I'm gonna inspect your ear and your ear canal. There's no drainage or anything with both of your ears. Okay, and everything looks fine. Now I'm gonna do a whisper test. I'm gonna close one of your your tables, and then I'm gonna whisper some words. So you're gonna say, like, can you close this ear
yes.
for me? And then you're gonna repeat the
1, 2, 3.
okay, the same thing we're gonna do with the other one.
1, 2, 3.
So you don't have any hearing deficit or anything. The ears look fine, no swelling, no no drainage or anything. And that's it for my. Now I'm gonna proceed to do your head and neck examination. Do you ever had a head injury?
No,
Any dizziness, vertigo?
no,
Have you experienced any concussions?
no,
Okay. How about your neck? Any pain in your neck?
no,
When you move, when you do range of motion?
no.
Okay, so I'm gonna begin with inspecting your head. Your hair looks fine. Your head looks fine to me. So I'm gonna start with palpation if there is any infestation, any bumps, any lesions. So I'm gonna check your head for symmetry. And I'm gonna see if there is any bumps or lesions or anything. And I'm gonna check your hair. Okay. They look fine to me. And how about your neck? The neck looks fine to me. No pain or anything. Okay, so I'm gonna check the trachea. It looks fine to me. It looks midline and no problem otherwise here. Otherwise, so I'm gonna check your first. I'm gonna check your range of motion. So if you can slowly move your head up, down, here, there, and then little bit if you can move. Any vertigo, any syncope?
No.
Okay, I'm gonna check your carotid and your jugular vein. So I'm gonna check your vein. Okay, I'm gonna palpate them. Okay, and I'm gonna auscultate them too. The carotid for the bruit. And I'm gonna check your thyroid too. So if you can, I'm gonna stand in the back and I'm gonna palpate your thyroid. So, okay. So that looks fine, your thyroid looks fine. And I'm gonna check your lymph nodes. So I'm gonna check all your sternomuscular, and no problems, no pain or anything. So your head and your neck and your lymph nodes and your trachea, your thyroid, they look fine to me. Now I'm going to check your thorax. So do you, I'm going to ask you if you have any lung problems, any
No.
emphysema, COPD, any respiratory problems?
No.
Do you smoke?
No.
Do you have any breathing issues?
No.
When was your last chest x-ray done?
1 year ago.
Okay. Have you ever had a PPD test done?
Yes.
and you don't smoke.
No.
Okay, so I'm gonna be doing some examination on you. So do you mind if you can take your sweatshirt out? So you don't have any lung problems, right?
No.
So first I'm gonna auscultate your lung sounds anteriorly and posteriorly. So if you can take a deep breath for me. I'm checking the lung sounds in all the upper lobe and the lower lobe. Okay. And inspecting the chest, it looks fine. It looks symmetrical. And do you mind if I just see your back? It looks fine to me. I don't see anything, any difference in curvature or anything. So now I'm gonna be checking tactile fremitus and bronchophony, and I'm gonna be checking your. I'm gonna be checking some other lung sounds with you. So first I'm gonna do any lung. First I'm gonna auscultate, and you're gonna say. I'm gonna auscultate. So for tactile fremitus, you're gonna say 99.
99. 99. 99. 99. 99. 99.
Okay. So I don't see any, it sounds clear to me, and I'm gonna check for bronchophony. Also, you have to, I'm gonna be auscultate because it rules out a consolidation. So you're gonna do the 99 again. I'm gonna auscultate. If you say 99 when I auscultate.
99. 99. 99. 99.
Okay. Now I'm gonna do agophony. So if you can say E, because if there is a consolidation, I'm gonna hear A. So when I auscultate, you can say E.
E. E. E. E.
Okay. Now I'm gonna do petrology. So whispered petrology. If I'm gonna say 1, 2, 3, if there is any consolidation, I should not be hearing that clear. So just say 1.
1, 2, 3. 1, 2, 3.
Okay. So that concludes your thorax examination. So now I'm gonna check your cardiovascular and your heart. So if you don't mind, you can lay down for me. Thank you. Do you have any chest pain? Any chest pressure?
No.
Any shortness of breath when you do take one stairs of flights or 2 stairs of flight? Have you ever been tested for high cholesterol?
Yes.
Okay, and have you ever, when was your last EKG done?
I haven't got it done.
Oh, okay. So now I'm gonna inspect your chest and your cardiovascular. First I wanna see the breathing and your heart, looks fine. I'm gonna palpate the point of maximal pressure. And then I'm gonna check your bruits. For the apical pulse for auscultation, it's at the 5th intercostal muscle and the mid-clavicle line. So I'm gonna auscultate your heart rate, S1 and S2. Okay, and I'm gonna also auscultate your carotid pulse. And I'm gonna palpate it. Okay, so vascular, your heart rhythm is normal. It's regular, and I don't see any skipping beats, any murmurs. I didn't sound anything. And while I'm doing your cardiovascular, I can also do your abdomen. Do you have any nausea, vomiting?
No.
Any GI reflux?
No.
Any bleeding? Any GI bleeding?
No.
Any blood in the stool?
No.
Any form of abdominal problems?
No.
So I'm gonna be checking your bowel sounds, and then I'm gonna palpate some. So I'm gonna check your in the all four quadrants. Now I'm going to check, I'm going to palpate your stomach for the rebound tenderness. If you don't mind, I'm just going to, it is for peritonitis. Is it hurting if I do this? Okay. It's not hurting, right?
No.
Now I'm going to do a deep abdomen palpation. So for any tenderness or anything. So I just want to see if it's hurting you anywhere. Is it hurting or any pain?
No.
Okay. Now I'm going to check for rebound tenderness. That's for peritonitis. So I'm just going to lift up your t-shirt a little bit. So if I'm just going to press with my finger, if it is peritonitis, it should hurt. Is it hurting?
No. No.
All right, so I'm going to check for Murphy sign. That's for basically for gallbladder and liver. So, right up. So I'm going to palpate a little bit. Is it hurting?
No.
Okay. So I want you to flex your knees if you can. That's your obturator sign. This is basically if you flex your knee. Is it hurting? If the appendix is inflamed, it hurts.
No.
Okay. And then I'm going to do again the flexion of knees, the iliopsoas sign for, this is for appendix 2. So if you can do flexion of your knees, is it hurting you?
No.
Okay. So basically, and then I'm going to check for assessing for the fluid wave too. So what I'm going to ask you to do, I'm going to want you to put your hand in the middle, and I'm going to, is it hurting like this?
No.
Okay. And if you don't mind, I'm going to check for your CVA tenderness too. So if you can sit, I'm going to percuss from the back. Or maybe you can just sit here. I'm just gonna like, yeah, I'm just gonna, is it hurting?
No.
From the back. Okay, so that's the percussion of the kidneys, so for your tenderness. So basically, we did for the gallbladder, for your, all your tenderness in the abdomen is not noted, so everything looks normal to me. And I'm gonna proceed. Upper extremity and your lower extremity test and carpal tunnel. Do you have pain in your wrist?
No.
Do you spend time on computer typing?
Just like 2 to 3 hours a day.
Okay. Have you ever noticed any problems with your range of motion, any swelling, any pain in your shoulders or in your movement in your arms and in your legs? Okay. So do you exercise and everything?
Yes.
Okay, so do you, if that's okay, if I proceed with the carpal tunnel?
Yes.
So I'm going to do a Tingle and Fallon test. So what you're going to put the hand like this. So I'm going to see if you have any pain or numbness in your thumb.
No.
Any paresthesia, any numbness. I can check with the other hand too.
No.
If I'm going to do like this, it's any pain or anything tingling in your hand?
No.
Okay, for the Fallon test, you're gonna do like this. If it is hurting, this is positive for carpal tunnel. You can do like this. Is it hurting?
No.
Okay, so you are negative for carpal tunnel. So we're gonna, if you wanna lay down, I'm gonna check for your upper extremities. First, I'm gonna inspect your hands. They look fine. Your fingers. I'm gonna check for your pulses. They are +2. They're strong. And I'm gonna check your capillary refill. Okay, that looks fine. And I'm gonna check for, I don't see any lesions. I did my inspection. I don't see any lesions, swelling in your arms. You're symmetrical. That looks fine. And I'm gonna try to like hold your hands, just push it against my, yeah. So it's +5, the strength. Like, okay. All right, so your skin turgor looks fine to me. And are you able to sit and we can do a range of motion? If you can do a range of motion of your like fingers and hands, if you can move your shoulder, is it hurting or anything?
No.
Can you, if you lift up your arm, you're gonna, yeah, the strength is good. And squeeze my fingers. Okay, there. All right, now I'm gonna inspect your lower extremities. I'm gonna check your legs for any venous distension or anything. No. I don't see anything. I'm gonna check your dorsal patellis pulses, or you can sit up so I can just show. I don't see any. Your legs look fine to me. And I'm gonna check your pulses. And if you want to lay down for me, I'm gonna inspect. They look fine. The pulses look fine. I'm gonna check your knee for the bulge and Bartoloma sign. Do you mind if I just if any swelling, I'm gonna put my finger. If there is any fluid, it's the swelling is noted, but it looks fine for the bulge and the Bartoloma sign. And I'm gonna check for your I'm gonna do the pulses look fine, and I'm gonna check your back for scoliosis. Oh, first, before that, I'm gonna do a straight leg test. That's for if you have any sciatica pain. So if you can lift your leg. Okay, do you have any pain in your hip?
No.
Okay, good. And then the other one. Okay. And for your lower extremity, we can also check if you can are able to like do a little range of motion. If you can just yeah, that's good. And you can like one knee like this. Is there any problems? And if you can just put your leg a little bit down. Yeah. Okay, that looks fine. All right, so I'm gonna check for scoliosis. If you can stand. So I'm gonna see if you can bend a little bit. So I'm gonna check your spine. There is an instrument with orthopedic doctors, they can check it, but your spine looks absolutely straight to me. There is no lateral curvature. Okay, it's good. So everything looks, the range of motion looks fine with the upper and the lower extremity, and your negative for carpal tunnel. So they look fine to me. I'm gonna check for your cranial nerves. Do you have any problems, any neurological problems?
No.
Any family history of any neurological problems?
No.
Any thinking, recalling?
No.
Any dizziness, vertigo, syncope?
No.
Okay. Any, I just want to know, like, what do you do for your mental health?
I work out, I read, and I watch TV.
Okay, that's good. So I'm going to be checking cranial nerves from 7 to 12. They are like for your hearing, for your swallowing, your acoustic, glossopharyngeal, vagus, spinal, and your hypoglossal. So what I want you to do is, I want you to do the, can you like blink your eyes? If you can take your glasses away. Yeah. I'm going to tap your forehead. Okay, and I want you to, with your eyes, they look fine. And I'm gonna, can you hear something? Like we are supposed to do with the tuning fork. I have something we can like, you know, so I'm gonna do like, you're supposed to tell me, and then I'm supposed to do the tuning fork behind your ear. And you're supposed to tell me how long you hear that noise. So another thing, I want you to do your cheeks like this and like this. Okay, and then do for I want you to rotate, yes, and then I want you to do have a sip of water, so for your swallowing. Okay, and I want you to shrug your shoulders, and so your teeth, can I see your teeth, your cheek? So all your cranial nerves are intact. So I'm going to do a Romberg test. If you want to stand and do your hand, I'm going to, and if you can close your eyes. Okay, your gait is fine. So it's a, yes, that's fine. You can have a seat. It's a negative Romberg and Pronado shift test, because if your gait is not equal and if you are closing your eyes and you're moving, this means it's positive. I want you to do the kinesthesia test. You want to do like up, thumbs up and down, like, yeah, up and down, if you can do. Okay, that's good. That's your kinesthesia test. I'm going to do the stenogenesis test. If you can, I can put a little object in your hands, and if you can close your eyes, and if you can close your eyes and feel the object. Can you tell me what is it?
It feels like 2 paper clips.
Oh, okay. And then I'm going to do a graphesthesia test. If I'm going to draw something, if you close your eyes, if you can tell me that, then your sensories are intact. Can you tell me what I'm drawing?
It feels like a straight line.
Oh, okay. I want you to do a tandem walking. So what we're going to do, we're going to do your feet front, and like you're going to put your feet like this. That's for the testing for your cranial nerves too. So I'm going to do that. I'm going to do that, if you can see that. Yeah. Okay. So then I'm going to be doing your deep tendon reflex. So basically we need a hammer for that. So what I'm going to do, like if I have a hammer, if I beat, like if I put the hammer like for your brachial radial, it should show me a reflex. And then the other one, I'm going to do it like this. So it should show me a reflex like this. And then I'm going to check your superficial reflex and testing. And I'm going to be doing, this is all done by the tuning fork. Unfortunately, I don't have that. And your, basically your cranial nerves from 7 to 12, all your swallowing, all your vagus nerves, your pharynx, oropharyngeal, glossopharyngeal, they are all intact. And your tandem walking, these are all testings for the cranial nerves. And your deep tendon reflexes are like once you do with the fork, the tendons should, when I hit on the tendon, like a little like slight, it should show me a reflex and the brachial reflex. So I think